Well, welcome back, ladies and gentlemen, to Cybin Inc.'s channel on a mission to revolutionize mental health care, developing new APIs via selective modifications of tryptamines and more. Welcome back, sir.
Hey, thanks for having me again. Good to be here.
Always a pleasure to have you on. So we got lots to kick off. It's been a little bit of a time since we've got some updates for the year. So I want to wind back a little bit. Can you kind of just talk about what milestones you achieved through 2021? Anything that really stuck out to you in the psychedelic industry?
You know, it's crazy. We've been I've been at the company about 18 months now, 18 or 19 months, and it's easy with the pace that we've been working at to forget that we're still a pretty young company because we've achieved so much. I mean, in the last year or so, we've raised over $100 million. We've listed on 2 stock exchanges, the NEO and the New York Stock Exchange. We've grown from 5 employees to 55 across 4 countries. We've established an ecosystem of 50 different partnerships, from chemical synthesis to clinical studies to clinical research units, investigators and therapists, established a supply chain in North America and in Europe, so we've got dual supply. We've expanded our patent portfolio across 3 families, and we've had our first patent issued for CYB4. And all of this, really, this progress has been to establish a foundation, a baseline, getting us ready for human studies, first in human studies for 2 molecules around the middle of this year. So it's been a really productive year or so, but just looking back at that, it's incredible how much we've achieved in that short amount of time.
From a broader viewpoint, just kind of taking a look at the sector, how have you seen it evolved over the last year?
Yeah, I think similarly looking at the sector, we're moving out of a period last year where there was a lot of hype, a lot of excitement, and news flow, but much of it was similarly based around companies getting started and getting programs up and running. This year, as we look forward to 2022, we're going to see a lot more human studies. And when you think about biotech in general, that's where the value inflection point really starts to begin. I mean, drug development value increases are exponential beyond phase 2. So that phase 2 is that really critical inflection point, and that's where we're going to be entering into in the middle of this year.
Speaking of drug development, I noticed that Cybin announces grant of U.S. patent covering its proprietary compound, that CYB004, which is a DMT-based compound for treating anxiety. Do you have any insights on that?
Yeah, so that's a big move. Obviously, getting the patent granted enables us to continue to protect the investment that we're making in that molecule. So the patent protects CYB4, our deuterated DMT molecule, and it also covers a number of other DMT and 5-MeO DMT derivatives. So there's a whole network of molecules there with composition of matter protection out to 2041. So that gives us a really long commercial runway to recoup an ROI on that program. CYB3 is also making good progress too. This is our depression program. It's an analog of psilocybin. We recently had a meeting with the MHRA, which is the UK equivalent of the FDA. Really productive and positive meeting there that gives us a high level of confidence in the preclinical work that we've been doing and the clinical study plans that we have coming up later this year as well.
Yeah, and speaking of actually coming into doing the trials and building out the pipeline there for 2022, I mean, you guys have a pretty robust balance sheet. We all know that this is kind of a costly game of just waiting this out and letting the trials fall through, but you guys are fairly in a robust place with $63 million in cash. You want to talk a little bit about cash spend and just kind of the forward-looking guidance that you guys are projecting out here?
Yeah, so we are well capitalized to start 2 human studies this year. Looking out, we have an average cash burn of around $10 million a quarter. We have some ups and some downs from that, but around $10 million a quarter. So that gives us a good runway. We have a pilot study for CYB4, an inhalation platform for our CYB4, targeting anxiety disorders starting around Q3, and our phase 1/2 depression study for CYB3 starting around mid-year. And this will be a study designed to show both what the efficacious dose is of CYB3 and what the impacts of a repeated dose is with CYB3. And the reason for doing that is that the best academic studies that we've seen, the ones that people get very excited about with psychedelics, use more than one dose, typically 2 doses, a week or 2 apart. So that's how we've designed our study. I think there was some disappointment with the durability of effect in the COMP360 study, and perhaps they could have used 2 doses. And we're hoping that the addition of a second dose in our study will lead to the durability we've seen in academic studies, which is benefits for patients that last for many months, 5 or 6 months at a time.
Great to hear. I think you've given us pretty incredible insight today, Doug. Appreciate your time.
Great to be here. Thanks for having me.
Always a pleasure. On that note, folks, I'm going to pass the question off to you. I'd love to know what you think about this sector and just general what's going on with Cybin here in that comment section below. Consider subscribing because as more news comes down the wire, we'll update you here. But in light of this, stay cool, stay awesome. And as always, I look forward to catching you in the next one.